welcome to Supreme Praise Radio and Women in Ministry this evening. It is such a privilege to come your way with another broadcast of Women in Ministry here on Supreme Praise Radio. If you've been following us throughout, you realize that we bring you topics for discussion that are worth hearing about. Last 2 weeks, we talked about sex in pregnancy, and I believe you did take away a lot because I did. It was a blessing. And today we're going to talk about perineal care after birth, which we laymen know as vaginal tears. Vaginal tears take care of that sort of thing after birth. And it is such a privilege that we have this wonderful lady here who knows what she's talking about. Mrs. Adelaide E. Edubofor. She's the founder and director of Perihealth Limited, which is a clinic, and it's a highly focused, and she is a highly focused and knowledgeable experienced midwife. She's been working in the NHS for a long time, and through many years of working on the delivery suite and providing consultancy, training, and routine teaching sessions on perineal suturing for midwives, junior doctors, and students. Her current role is a perineal specialist midwife, and she works in a very busy NHS maternity in London, and where she has established a thriving perineal clinic. Sister Adelaide works with midwives on the labor ward to improve their competency in perineal assessment, and more importantly, deepening their skills and knowledge in suturing. She also works as a part-time midwifery lecturer at the University of West London. She facilitates suturing workshops for student midwives at that university. She's also a published author, as we said the last time. She has a book called Sex and Romance During Pregnancy and Afterbirth, What Expectant Couples Should Know. And this book is available on Amazon in hardback and in Kindle format. Please get yourself ready. We are live on Supreme Praise Radio, online, on Facebook, and on YouTube. We are also live on Faith Channel Radio. We are live on Channel of Mercy. We're streaming live again on Wisdom for Victory Devotional Facebook page. So please tap in wherever you're from. Leave a comment, leave a question, and we will pick it up, and Sister Adelaide will answer it for us. Yes, for us, because I'm also here to learn. So she will answer it for us. So yes, please get ready. Stanley, this is your platform. Please feel comfortable. I have a lot of questions to ask you. So
okay.
Yes, this will be awesome.
Oh,
please.
Thank you so much, Sister Eva, for such a wow introduction. Thank you for that. And I'm so delighted to be back after 2 weeks to address such an important topic, and yet it's such a silent topic, hidden under the carpet, and nobody really talks about it openly because it's such a taboo topic.
Yes,
just as we said about the sex and childbirth topic. So I am very delighted and privileged to be given this platform for us to explore and discuss the issues around us, and also to demystify the whole idea of not talking about it, so women or couples or the whole public will feel comfortable to actually discuss this topic. You did mention we are going to talk about perineal trauma, and a lot of people will wonder, what's this perineum we're talking about? Do you have any idea? Just like we did last year, let's make this a conversation so it's nice and interactive. It's a shame our listeners can chit chat with us, but at least we can chit chat to them. So any idea when we say the perineum, do you have any idea where this is? Audrey?
Well,
you did mention it earlier on in your introduction. So when we say perineum, the public will think about the vaginal area, but actually it's the space where, when you go to the bathroom, it's the space between the vagina and the back passage. Yeah. And for the men, the space behind the scrotum and the back passage. So you know that space there, that skin space there, that's what we call the perineum. Okay. And normally when women go to have their babies, that's when there is always a potential risk of the perineum tearing. And it normally tears from the vaginal wall out to the perineum. Do you have an idea how many women, when they go to have a vaginal birth, how many women are likely to sustain perineal tear? Do you know the percentage by any chance, Sister Audrey? Do you know the percentage by any? It doesn't matter. This is not a test. This is a conversation.
I can have a guess.
Yeah, have a guess.
I'll probably say about 60%.
Come up a bit more, Sister Yuba. Come up a bit more. Let's see if you beat Audrey. A little bit more.
Well, you've given Sister Eva a clue, so
come on, Sister Eva. See if you can beat Audrey. So,
to be honest with you, should we say 70?
Yeah, very close, very close. Do you want to try, Audrey?
So it's higher than 70.
Yes, it's higher than 70. Yes.
Okay.
So that's very high.
I'm going to go slightly higher, not too much. I don't want to get too excited and say 75.
Yeah. Okay. It's 85% actually. Okay. So you see, that's very, very high. Okay. But before people get anxious, we have classifications in the test. So it's not every woman who is going to get that extensive tear. So it's kind of divided into classifications. So some women will have just what we call the first degree tear, which means it just involves the skin. So before we even said you don't need to stitch it, but we just realized that there was subjectivity in the assessment. So in order to prevent any confusion, we actually stitch it. But if you don't, the thickness of the skin is just like a sheet of paper. So if you don't stitch it, it's still going to heal, first degree tear. So between first degree tear and second degree tear, that's where we have 85% of women potentially sustaining it. So for example, if you have 10 women laboring who are going to have vaginal birth, it means between 8 and 9 of them are likely to have some form of tear, starting from just grazing first degree right up to second degree. And in some cases, they may not tear naturally or spontaneously. They may actually end up being cut. I don't know whether you've come across that. We call it episiotomy. So for example, say if the baby is coming and the baby's heartbeat is dropping, we need to deliver the baby quickly. It takes time for the whole skin to stretch to the maximum before we deliver that baby. We don't want that baby to come out really tired. So we may end up having to give you this deliberate cut called episiotomy. So the structures involved in this episiotomy is very similar to that of second degree tear, which means it goes beyond the skin. It involves the muscle. This is fine. It can easily be repaired and it can heal quite well. Now, there is the more complex tear, which is called the third degree tear or the fourth degree tear. I don't know whether you've come across that. And this is where the tear goes into the back passage. We do have this natural elastic band in our back passage. It's a muscle that controls our pull or wind, okay? So do you remember whenever you went for a shopping or you went to church or you went for an event and suddenly you realized you needed a poo and there was no toilet anywhere, but you were able to control yourself before you got home, before you open your bowels? That is called that anal sphincter. Or when you are standing next to your new partner, he's just proposed to you and you are still very shy of him, right? And then suddenly you are sitting next to him and you realize you need a fart. You cannot just do the fart because he will think so not highly of you. So for you to be able to control the wind and then get yourself to where you can actually release the wind, that is your anal sphincter protecting you. So that anal sphincter occasionally or very rarely can also get torn. And that's where you get the 3rd-degree tear or the 4th-degree tear. Thankfully, the percentage of that is not too high. It's about 6%, but we still feel that 6% is still quite high. And we're still trying to work so hard to try and bring the percentage down. And normally it's, if you get the mild 3rd-degree tear, you may just kind of get away with it. But sadly, if you get a very complex one or the 4th-degree tear, this is where you hear somebody had a baby and the next thing, they can't control their bowels, they can't control their poo. If they need to go now. If not, they're going to soil themselves, or actually they soil themselves without even realizing that they soiled themselves. I don't know if you've come across that at all. It's not very common, but it happens. The reassurance is not very common. We also have another form of tear called the fistula. So the fistula or the buttonhole tear is normally when that baby is coming out, or when that baby has been, the lady has been in labor for a very long time. There is that persistent pressure on the vaginal wall. And then this tear can then lead to the back passage. So when it leads to the back passage, we call it vaginorectal fistula or fistula. In this case, when the lady does a poo, it comes into the vagina. Do you see why I am emphasizing, if you've had a baby and you are experiencing any of these things, do not suffer in silence. You need to approach a medical personnel, your general practitioner if you are in the United Kingdom, or if you are in other parts of the world, whatever the medical system is, you need to approach a doctor or a nurse or a midwife who can actually give you the support you need and the right management to try and control or treat this. Very, very important. So are we happy with the perineum so far? Do you think I've broken it down well enough?
Excellent.
Do you have any questions for me, Audrey? You are asking questions on behalf of
Not at the moment. Yeah? Not at the moment.
Happy for me to proceed?
This perineum, okay, with the statistics you've given us, I mean, if 8 to 9, that means, I mean, for 8 to 9 out of 10 women will have a tear. Is it natural? Did our mothers have this tear when they were giving birth?
Yes,
I mean, in the olden days, have women always had this problem with tears?
Yeah, it's always been there, but unfortunately, because it's such a hidden thing, remember what I said, is not everybody is going to have that same extent of tear. Most of them are quite mild and it's natural. The skin has to stretch for that baby to come out. And to just reassure people, because this discussion is not to scare women, particularly those who've not had babies before, because by all means, vaginal birth is far much better than having a cesarean section. The skin stretches, so it starts from grazes to 1st-degree, 2nd-degree tear, or where baby is tired, we need to cut you. So yes, in the olden days, it was there, but it wasn't just spoken about. Childbirth is secret, it's women's stuff, men don't even go there. So if there is a tear, they're not going to say it. But then those times they had a way of kind of managing it, and we'll come to the management and we can discuss that. Also, there are things that women can do to try and reduce this test, or reduce the test from perineal massage. We will normally encourage during pregnancy to start perineal massage around 35, 36 weeks. So when you start that perineal massage, it stretches the vagina nicely, and that can reduce the chances of tearing. I can tell you that with some women, the very first day they just realize that they are pregnant, they do not even want to touch the vaginal area, let alone doing the perineal massage. So the whole place gets a bit tense, and then when it comes to that baby coming out, then it has to stretch at that time, and that is where it also increases the chances of tearing. Again, if you're having a big baby, that can also increase your chances of tearing. If you're having instrumental delivery, there is a chance of us performing the cut or the episiotomy that I talked about. The other thing is encouraging women to actually, remember we talked about sex is safe, especially if it's low risk last time we had our discussion. So, and as long as you don't have the things we mentioned, like the placenta previa, the waters breaking and any bleeding. You have no complications. It's a low-risk pregnancy. Particularly towards the end of the pregnancy, it's very important to have sex because it helps to stretch the perineum. And that can also reduce the chances of tearing. But yes, our mothers and grandmoms, they all experience the tears. It's just that it was such a hidden thing. Why do you think they always say you had a baby sit on hot water? Why do you think they were doing that? Are you aware they did that?
Yes.
Yeah. Why do you think they were sitting on the hot water?
Well, because I was told that hot water needs to enter, the vagina and all that.
Yeah.
But I never knew that, there could be a cut in there.
Yeah, it was all part of it. So
I think women need to be truthful, and tell things about our bodies as it is.
Yeah, it's natural. And just to reassure women, sometimes when this tear is occurring, the power of the contractions, the labor, the power of the contractions is far more superior over even the pain of the tear at the time. So the woman may not even realize that she's tearing until the midwife tells her that actually there is a little tear here, it needs stitches. So it's just to reassure women that it's not as bad as it's been described. Okay, so once you've had a tear, there is no cause for concern because as midwives and doctors, we are trained to fix it or to repair it. So we're gonna put in some stitches, and these stitches will have to be dissolvable stitches that dissolve. In the past, in the olden days, they used to put stitches that you have to come back for it to be removed. But all that is past now. Now, when you've got stitches, it dissolves. And it takes about 6 weeks to totally dissolve. But within the first 2 weeks, you should feel a lot better. So initially, when you've had the stitches, it's natural, just like any operation. It's a small operation down there, isn't it? It's going to be quite painful. So what can women do to try and reduce this pain? We recommend that you use ice packs. So ice packs can be a good form of pain relief. But when you use the ice packs, don't put the ice packs directly on the perineum because that can actually some burning or ice burn. So what I normally recommend to women is you have a clean sanitary pad, soak it in water, put it in the food bag and put it in the freezer. So let it come really cold, and then you apply that sanitary pad directly on the perineum. It's found to be very soothing and it also relieves pain. But you shouldn't put it there longer than 10 minutes at a time. You can also encourage women to sit on soft pillows because if the area is sore, some people actually have pillow rings. So when they sit on the pillow rings, they don't put pressure on the wound. Again, going back to what our moms and our grandmoms did, we can also, research has shown that you can also apply warm compresses, which also helps with circulation and helps to relieve the pain. And if all these measures are not really making that much effect, then you can go painkillers. So with the painkillers, if you are not allergic to paracetamol, you need to speak to your doctor. They may want to prescribe something for you, but start with paracetamol and also any anti-inflammatory tablets like ibuprofen, because the ibuprofen helps with the healing. It helps with the inflammation, and the paracetamol also helps to control the pain. So you don't take the paracetamol less than 4 hours in 24 hours. So you can take 4 hourly for the 24 hours. And after about a couple of days or 3 days, if you are not seeing any difference, then you need to speak to your doctor. The reason why I say that is, yes, occasionally things can go a bit wrong. For example, if you were bleeding profusely while they were trying to stitch, they would controlling the bleeding will be their priority. So they will have to stitch really quick. And in that case, some of the tissues may not align properly. And this is what we call misalignment. So if you've got that misalignment, that can be quite painful. Also, there can be a little bit of blood collection there, which we call hematoma. So hematoma is a collection of blood under the muscle tissues, and that can also cause quite a lot of pain. And this is why I say, if you are in pain, do not suffer in silence. You need to tell somebody, a healthcare professional, a midwife, a doctor. Another thing that can cause the pain is when you have infection, because it's a wound. Look at where the location is between the vagina and the back passage. So up there, there is the urethra where you are passing urine, and then there is the back passage when you are doing a poo. And all this urine or poo can contaminate the womb, and then you can get infected. So it's very important that when you have the pain, it could potentially be infection. You need to report it so we can treat with antibiotics to try and treat or get rid of it. The other thing is the stitches can also become undone, okay, as in it can open or break down. That's quite common. And if you are in pain and you say, well, because there is that belief that you've had a baby, it's painful, just shut up and put up. No. When you are not comfortable, you need to speak up, because there may be any of these things that I've listed. It could also be quite swollen. So if you don't say anything, nobody can help you. And on this note, occasionally, I don't know, whether it's Ghana or United Kingdom, whoever is listening to me, but I believe some of these practices cut across board. Sometimes the midwives visiting can be quite busy. So it may even escape them, even though it's part of our role to check, it may escape them to check your perineum. So if you find that they've visited, they've checked you, they've checked the baby, but they've not asked to check for your stitches, you have to ask them, remind them, could you please check my stitches and make sure that it's all healing well? On the other hand, some women have also refused to be checked. And why would women refuse to be checked? They refuse to be checked, one, because they feel embarrassed. Two, they may feel that I've not had a shower yet, so I don't feel like on top of my personal hygiene for somebody to just spring up and check my perineum, so I'm not. Or they could be friends or family members around, or she could be feeding. So all these reasons can actually lead the woman to decline the perineal check. So it's very important with the things that I've highlighted to make sure that you actually give permission for the midwife or the nurse or whoever is visiting you to check the stitches to make sure it's actually healing well and there are none of these complications. And please, even if you haven't had a shower, don't feel uncomfortable. Come on. This is our job. It's natural to us. It's not a problem at all. So do not let that hinder you. So moving on from pain management, the other common issue when women have had stitches is called constipation. And why do women get the constipation? Some of the women may be given the strong painkiller called codeine. And now codeine can actually cause constipation. So we advise that you drink plenty of fluids. The reason why I say plenty of fluids is naturally, I know if you tell women to drink plenty of water, come on, I'm sitting here, I hardly go through a liter of water a day. It can be quite boring, isn't it? So if you say fluids, then they can just have variety of different fluids, not too much of sweet drinks, because obviously you don't want your sugar levels to go up. You can spice up your water with lemon or something that will actually encourage you to drink a lot more fluid, soup, whatever. Very important. Trust me, if you think, okay, I'm not going to go to the toilet because I've had stitches. I understand that, because women feel I've had a stitches. If I go and open my bowel, the stitches will become undone. And that is why most of them are anxious about going to the toilet. Day 3, I promise you, the poo will be coming like another baby coming from your backside. So you may as well deal with it right up. So by doing that, drinking plenty of water, eating high fiber stuff like Weetabix, cereals that have high fiber in it, vegetables, green leafy vegetable, broccoli, spinach, all that kind of stuff, sweet corn, they can all help. Fruits can all help to relieve the constipation. But a practical tip to help is When you go to the toilet, you can actually, before you go, you wash your hands, and then you take your sanitary pad, and then you press the sanitary pad against the perineal space where the stitches are when you are opening your bowels. So it feels like you are putting some extra support there. And in that case, you can open your bowels. But by all means, avoid constipation, because if you don't, eventually it can be quite uncomfortable. Okay. It's also very important to take care of your bladder. Yeah. The urine works. Very important to take care of it. Because again, you may want to try to avoid passing urine because you feel that it's the urine. Sometimes women complain that the urine burns the wound area, it causes burning sensation. Back to the same advice, you need to drink plenty of water. You've just had a baby, there's been pressure in that area. So we want to make sure that you are actually passing urine well and emptying the bladder very well, flushing your system with plenty of fluids to do that. Just to make sure that the bladder is working. After you've had the baby, we observe you to make sure that at least you've passed urine within the first 3 to 4 hours to make sure that your bladder is working well. Okay. Personal hygiene is another thing. And in my clinic, I've observed that a lot of the women, if I'm seeing 10 women a day, 9 of them would have poor personal hygiene. I'm talking about not just general personal hygiene, I'm talking about perineal hygiene down there. You know, the way women are created, our genitalia is kind of nicely into folds. We have the clit, we have the labia or the lips in between, and then the bigger lips on the outside. So the space between the big lips and the small lip is usually kind of folded up, and that is where dirt can hide and create this offensive odor. So when you've had the stitches is down in the perineum, it's nowhere near up between the lips, the 2 lips up there, or even the clits. So I just encourage women to be confident, touch yourself. Now the question is, what do I use to wash myself? That's another common thing that women ask. And again, when you talk to women, all kinds of products to wash the vaginal area. We strongly recommend that you don't use any products to wash the vaginal area because it can cause irritation. Besides the irritation, because some people will use soap, some people will use Dettol, name it, salt, all kinds of things, herbs. Apart from its potential causing infection and the irritation, it can also cause something we call vaginal thrush. So this vaginosis, this is where you have increased vaginal discharge and or infection, shall I put it in that simple way? Go ahead, Eva, you wanted to ask a question.
I think here in UK, after birth, women are advised not to have a wash for a while. So
no, that is false. I don't know where they got that from. For personal hygiene, you are supposed to wash yourself. And people have asked, oh, if I sit in the bath, it's going to dissolve the stitches. There is no research to back that up, actually. Obviously, we don't recommend that you sit in a bath for long hours. And in the hospital, the reason why we discourage people from sitting in the bath, not shower, in the bath, is because it's a communal bath. And therefore, even though we wash it, there is the potential risk of cross-infection. But if you are in your own home and you have disinfected and washed your bath, there is no reason why you cannot soak yourself in the bath for 10, 15 minutes. That is absolutely safe. And these days, we even do what we call the subcuticular stage, which is hidden under the skin anyway. So there is no evidence to suggest that. Plus, I said earlier on, the stitches are located in an area that's very vulnerably exposed to poo and urine. So if you don't clean properly, that can actually cause infection. So we recommend that you use warm water to wash the area. Just warm water, nothing else. Because as I said, if you're using any other product, that can cause irritation or increase the risk of infection. So that is the current advice. We need to wash ourselves with warm water and pattern the labias or the lips up so that you can actually stick your finger in between there and make sure it's properly to reduce the risk of infection or to help the wound to heal well. And once you've washed, it's very important to try and dab it dry. Again, there is so much advice going on out there. Some women have been advised you need to keep the area dry. So open your legs up. Some people have even suggested or told women to try and dry the area with hand dryer. It's all false. I mean, seriously, how do you dry the area with hand dryer? How? Anyway, apart from it not making any effect, again, research has shown that the best way for wound to heal is in a moisty environment, and that area is moisty. And this is why you need to just keep it clean. You keep your normal pad as usual and just carry on as normal, and the body will heal itself beautifully. So far, so good. Do you have any questions for me, Audrey?
Yes, I do. I'm thinking about in UK in particularly, there are particular cultures, as Sister Eva mentioned, that do not take bath after birth. And if such individual has sustained either a piece or any sort of a tear, any sort of tear, what degree it is, how did they keep the place clean in order to avoid infection? Because it's a culture for them not to take a bath a few days after birth.
Yeah, it's true. It's true. And we do all have cultures, don't we? So we have harmful practices in cultures, and we have positive or good practices which we encourage. So this is where we come in as healthcare professionals to give health education, because sometimes people just follow their cultures without even understanding the harmful effects. And once you've explained to them, I've actually come across several women from those backgrounds. You've educated them and explain. It's all about communication, explanation. Explain to them why they need to do that. Then it's usually not a problem. They know why they are doing it is to prevent infection. And then you find that most of them will actually do it. They will wash themselves.
Okay. My second question is, we spoke about infection in the perineum when there's a tear or there is a piece that you've had the stitches to. How would first-time moms who have not come across such before will know that the wound is infected and would act quickly and appropriately? Because they might not come across such before and they don't know. What are the signs, if we can put some of the signs out there so they are aware that if you're surgeons and things like that, so then they are aware that I need to speak to somebody. I think my perineal wound is infected.
Yes, I think you've said some of it already. And before I even proceed with whatever I need to add to that, in my clinic, I noticed that a lot of women have never seen their vaginas before. They don't even look. And I wonder, I mean,